So early in the pandemic, there was growing research evidence, as well as media reports suggesting ethnic minorities in the UK were experiencing a disproportionate impact from COVID. That was both on morbidity and mortality. And among the minority groups particularly affected or more at risk of these poor health outcomes were older adults from the Asian populations. Research also shows that culturally tailored health communication is, not surprisingly, more acceptable and increases understanding. And the media had also picked up on this fact. So there were press articles and criticism that public health information on COVID was not hitting the spot and lacked sort of cultural nuance. So we focused our research on two South Asian communities. So older adults from South Asian backgrounds often share living spaces with younger people. They might have a prevalence to conditions such as hypertension or diabetes, diseases that make them as an individual more vulnerable to COVID-19. However, it was really important that we recognise the cultural differences within these communities and didn't just treat them as one. So the study was all about building relationships with both Hindi-speaking and Nepalese-speaking communities. We wanted to work as equal partners in co-producing the provision of health information and health information that was understood and spoke to those communities that we were working with. And this approach was used from outset and throughout the project, so including the proposal and the design and the co-production and implementation of the health information resources. This allowed the research team to listen and get a real deep understanding of the issues, what information should be included in the leaflets, and how the communities wanted to receive the information. The research team ran a community of practice event with community groups, public health colleagues, and health and care practitioners across the region, so sharing both the process and launching the co-produced leaflets. And by listening to the community, we knew that whilst digital versions of the leaflets were acceptable, there was also a request for hard copies to be printed and distributed throughout the local communities in Kent, Surrey and Sussex, which the research team have also provided. The digital leaflets were then shared across the region through our ARC networks and our AHSN networks, and this ensured a wider reach and interest across the UK and abroad. And I think for me, the important message to take away is to change the language used to describe working with diverse communities or ethnic minorities, which are often termed as hard to reach. The communities we work with were really keen to participate and share their experience and help ensure that the information provided was culturally appropriate, and this helped ensure engagement and understanding. And it was a real privilege to be part of this project.